Welcome, everybody. My name is Dr. Brian Hartman. I'm an emergency medicine physician who is also dual boarded in obesity medicine. Now, I used to work with Emerge as a telehealth physician, but as I addressed in prior videos, we've closed that business down and no longer provide direct medical care. So Emerge is now a concept and a brand for health and wellness videos. So today, I want to talk about fatty liver disease, or non-alcoholic steatohepatosis, or non-alcoholic fatty liver disease, or as it's called now, metabolic associated fatty liver disease. Now, this is a condition where excess lipids are deposited in the liver, causing an inflammatory state that can eventually lead to scarring, cirrhosis, and liver failure. In fact, it's actually the most common form of liver failure in the United States now. It's past hepatitis C and alcoholism. Now, we see this on abdominal imaging routinely. Incidental note made of fatty infiltration of the liver. It's tossed to the side and usually ignored in the commentary, but it's a huge problem, and it needs to be addressed. So I compare it to someone coming in for shortness of breath, and we get an x-ray, only to see a 5-centimeter lung cancer sitting in their chest. Then going back, sometimes we find a small nodule a few years ago on an x-ray that was mentioned, but never followed up. Imagine your stomach starts to swell, your eyes turn yellow, and you get a crazy rash all over your body. You go to the doctor and find out you have cirrhosis, and it was caused by something noted on imaging from years ago, yet you were never even told about it. Imagine you had elevated liver tests for years, but no one said anything or bothered to treat you for it, and now you have liver failure. So I saw a patient the other day with fatty liver commented on the CT scan. Their liver function tests were also elevated, and I went in to talk about this with her, thinking I was going to break some ground and have a bit of an awkward conversation, but she stopped me and said she already knew about that and her doctor was watching it. Not aggressively helping her with weight loss to stop the disease progression, literally doing nothing other than repeating labs and imaging every year. Now, this patient had heard about Ozempic for weight loss, but never really looked into it because their doctor wasn't concerned. Now, there's no excuse for this in today's medical system. If you have an ultrasound, CT, or MRI of your abdomen that comments on fatty infiltration of the liver or something similar, it's time to be the squeaky wheel. Inflammation of the liver is bad and should be treated, not ignored. GLP meds are great for this. If you could get brand name Ozempic, Wegovy, Mounjaro, or Zepbound, great. If not, consider compounded medications to get the same effect. You don't want liver failure. Now, as you can see, I'm making videos again and expanding the topics beyond obesity medicine. I'm actually a fiction author as well and starting my YouTube presence over there and would love to have you follow me there as well. Now, I'm starting a podcast there guaranteed to entertain you while making you think about your own health and also what's happening in the world. The femur will play a prominent role. I'm actually 3D printing a lot of stuff that hope to use with that too. So click above and check it out. Videos are going to be posted soon over there. Now, as a final point, just in healthcare and your life in general, it's up to you to take control. You can't expect a doctor or anyone else to fix your problems or to care about it as much as you do. So educate yourself through videos like this, online groups, and anywhere else you can get information, and then show up to your appointment with specific questions. Doctors should respect you enough for caring about your own health to be prepared and motivated to make a change. Now, let's get healthy together.